Hello, this is Dr. Steele. Today I want to talk to you about EKG. You heard it before, EKG is an electrocardiogram. And the simple way to know about EKG, a simple way to explain it is the electrical activity of the heart. Just like in your house, you have the electricity, right? And it runs through wires to turn on the lights, or the television, or your toaster. Your heart has a system that we can actually get a tracing from that electrical activity that tell us not only if you have an acute problem or if you have had something in the past. And of course, you need to remember that the two main places that the heart we need to explore when somebody has diabetes is not only the electrical activity, but also the vessels, right? The coronaries, which are like the pipes where the blood goes through. And if they get obstructed, you get a heart attack. But as well, the electrical activity can be affected after the heart attack, or it can be just an isolated problem. And for us to be able to diagnose, we need to do a simple EKG that has been around for a long time, because even now, without our recent technology, the EKG is still very important. So we can now look at rhythm disturbances like atrial fibrillation, fancy word, right? We also can look at previous heart attacks because, as you know, dead things don't move, and dead things don't let the electrical system go through that dead tissue. And we also can see problems with the heart if the heart is enlarged. Why? Because the electricity is going to go in different directions because of that. And that could signify that you have had hypertension. That means high blood pressure for a long time. And the heart is having a rough time pushing the blood out of the heart. Also, if you have lung problems, we can see changes in the EKG. Also, if we have problems with genetic disorders that alter that electrical function in the heart. Also, to let you know that sometimes every time you go to the doctor, especially if you're older like me, just like me, we ask for an EKG. And it's so important to do it. Just let him do it because it does give, especially in my specialty, which is I'm an internist, internal medicine. It does help a lot to diagnose things before the patient sometimes feels anything. Well, that's my talk for today. An EKG, a very important tool for us doctors to take care of you. For now, remember, as I always say, take care of yourself because